But we're going to begin with more help on the way in the fight against the coronavirus, and it's help coming from the United States military. President Biden a short time ago announced additional medical teams will be deployed to overwhelmed hospitals in 6 states, and it comes as the CDC reports they need it. Hospitalizations are up a third in the past week, and COVID deaths have climbed 40%. For more on all of it, let's go to CBS News correspondent Natalie Brand.
President Biden got an update from the field from federal teams sent to communities hardest hit by COVID, from Arizona to New York.
When you need something done, call in the military.
The administration today is announcing new deployments of additional military personnel to overwhelmed hospitals in New York, New Jersey, Ohio, Rhode Island, Michigan, and New Mexico.
Military doctors, nurses, and medics helping staff the hospitals are in short supply. This is on top of more than 14,000 National Guard members that are activated in 49 states.
The president also said the White House will be announcing a new plan next week to distribute high-quality masks to Americans for free. The White House previously announced plans to ship 500 million free rapid tests to Americans. Today, the president said he wants to purchase another 500 million tests to meet future demand.
We're on track to roll out a website next week where you can order free tests shipped to your home.
Some states, especially in the Northeast, are reporting they're starting to see a decline in new cases, meaning they may have hit the peak of the latest Omicron spike.
It takes 3 weeks to go up and starts coming down as fast as it went up.
But contributing to the current spread, Dr. Ali Makdad estimates about 80 to 90% of all infections in the U.S. are asymptomatic. Natalie Brand, CBS News, the White House.
For more on all of it, I'd like to bring in CBS News senior White House correspondent Weijia Jiang. Weijia, good afternoon for a change. We're used to saying good morning. Let's talk about the Biden administration's announcement of military aid for hospitals in a half dozen American states. What more do we know about the rollout, and is it enough?
Is it enough is the important question, Tony, but we won't know the answer until these guys are out there and helping these hospitals and the staff to relieve some of the pressure that they've been feeling now going on 3 years. So the idea here is to have personnel be able to triage patients, to relieve some of the stress that they've been feeling so that the doctors and healthcare workers at these particular hospitals can focus on other patients that have other ailments other than COVID. And so 6 different hospitals have been assigned these teams. They will go to the Cleveland Clinic in Ohio, the Coney Island Hospital in Brooklyn, the Rhode Island Hospital in Providence, Henry Ford Hospital just outside of Detroit, the University of New Mexico Hospital in Albuquerque, and the University Hospital in Newark, New Jersey. Because again, the administration has identified these specific places as being overwhelmed and really carrying the burden for their states as they continue to deal with surges. And so this is another deployment in addition to 800 military personnel that have already been helping in 24 different states. The president says he's also working with FEMA to try to make sure they have enough hospital beds. But Tony, as these surges happen, it's really difficult to tell how much more need there will be because we don't know how the spikes will continue to trend. But hopefully, the good news is it looks like some of these surges are beginning to slow down.
Weijia, let's talk about testing, because it seems like the president is promising additional testing, and yet we are still facing shortages in many communities right now. And as I understand it, the first 500 million tests that were promised have yet to be made. So he's betting twice on some manufacturing that's yet to be done.
That's a really important point, Tony, because even though the president has announced that he has ordered these tests, procuring them is very different. Getting them actually in your hand is very different than placing an order for them, right? And so he has already asked for 500 million tests, as you mentioned, and those will be to fulfill orders in a federal government website that is supposed to launch sometime this week for people to go in, order the tests that they want, and then it will be shipped for free to their homes. But I just pinged one of our best sources on the COVID response to ask how many of those 500 million tests have actually been manufactured and are actually available at this time, and was not able to pin down a specific number. They said it was, quote, a lot, but that doesn't tell us how many of 500 million tests. So we're still digging to see how many that is, because again, you know, these companies had to ramp up their manufacturing, which was not done over the summer, which is the big criticism now of the Biden administration. And that's why there's such a scramble now. So even though the president did announce another order for 500 million tests, you're absolutely right. When they'll actually be available to ship out to people is a very different story.
Yeah, it sounds like quite an uncomfortable position for the administration to be making promises before they actually have the product in hand. We'll see if the manufacturing can catch up to the rhetoric. Let's talk about high-quality masks. That's something else the president mentioned. He says the government's going to make those masks free. What's the guidance on how people will be able to get those?
Well, he said that the formal announcement with all those details will come next week. The important piece of news here is that they are working to provide these KN95 masks, these N95 masks, to Americans who want them. And just yesterday, White House Press Secretary Jen Psaki insisted that there is no shortage. So everyone who wants one of these masks should be able to get one. So we'll learn more next week about how that's going to happen, whether you're going to have to place an order like you will for these at-home tests. But Tony, one really important note is that yesterday, the director of the CDC, Rochelle Walensky, during her briefing, said that the CDC had no plan to change the guidance to recommend these high-quality masks over cloth masks, over the other surgical masks that we've seen. And I asked why not? Because if you're following the science and the science shows that some masks offer better protection than others, why aren't you revising the recommendation? And she said that she has to factor in what people are comfortable with, what they are willing to wear. And so she said that the best mask is the one that you can tolerate for the longest time, which I thought was really interesting, because that's the same thing she said when she scaled back the guidance for the isolation period if you are infected with COVID from 10 days to 5 days. She said one big factor was that she saw people simply could not stay in one place for 10 days. And so that's how they are explaining why, even though they will be making these masks available to Americans, they will not formally be recommending that you choose one over the other if it's not comfortable for you.
Yeah, I mean, that makes sense to me. It's one thing to write out a recommendation on a website. It's quite another thing to live that recommendation for 10 days, as you mentioned, with isolation or with an uncomfortable mask for many hours during your workday. Weijia Jiang, thank you very much. I appreciate it.
Sure.